Coordination of muscle movement requires that four areas of the nervous system function in an integrated way. The motor system for muscle strength, the cerebellar system for rhythmic movement and steady posture, the vestibular system for balance and for coordinating eye, head, and body movements, the sensory system for position sense. To assess coordination, observe the patient's performance in rapid alternating movements, point-to-point movements, and standing in specified ways. For rapid alternating movements, show the patient how to strike one hand on the thigh, raise the hand, turn it over, and then strike the back of the hand down on the same place. Urge the patient to repeat these movements as rapidly as possible. Now ask the patient to tap the distal joint of the ventral thumb with the tips of the fingers in sequence. Observe the speed, rhythm, and smoothness of the movements. Ask the patient to repeat these movements on the other hand. For the legs, ask the patient to tap your hand as quickly as possible with the ball of each foot in turn. Note any slowness or awkwardness. The feet normally perform less well than the hands. Next, assess point-to-point movements. Ask the patient to touch your index finger and then the nose alternately several times. Move your finger continuously so that the patient has to change directions, and observe the smoothness and accuracy of the movements and watch for any tremor. Then, with your finger held steady in one place, ask the patient to touch it, then raise the arm overhead, and then lower it to touch your finger again. After several repeats, ask the patient to close both eyes and try several more times. Normally, a person can touch the examiner's finger successfully with eyes open or closed. To test the heel-to-shin movement of the legs, ask the patient to place one heel on the opposite knee and then slide it down the shin to the big toe. The patient should be able to do this smoothly and accurately. Repeat with the patient's eyes closed to test for position sense. Continue the examination by observing the patient's gait, which provides information about coordination, position sense, and muscle strength. As the patient walks across the room, observe posture, balance, arm swing, and leg movements. Normally, balance is easy. The arms swing at the sides, and turns are accomplished smoothly. Next, ask the patient to walk heel to toe in a straight line. This kind of gait, also called tandem walking, demonstrates cerebellar function and position sense. Then have the patient walk on the toes to test the strength of plantar flexion, and on the heels to test dorsiflexion at the ankles. These actions also test balance. Next, ask the patient to hop in place, first on one leg and then the other. This ability indicates an intact motor system in the legs, normal cerebellar function, and good position sense. Finally, ask the patient to do a shallow knee bend, first on one leg and then on the other. Support the patient if you think there is danger of falling. The Romberg test primarily tests position sense. Ask the patient to stand with feet together and eyes open. Then, have the patient do the same thing for 30 to 60 seconds with eyes closed. Note the patient's ability to maintain an upright position with only minimal swaying. Now check for pronator drift by asking the patient to hold both arms forward and parallel with palms up and eyes closed for about 20 to 30 seconds. Normally, patients can hold their arm positions well. Finally, ask the patient to keep both arms up and eyes closed while you tap the arms briskly downward. Normally, the patient's arms return smoothly to the horizontal position.